Consume garlic, but avoid these 6 errors, as they can be detrimental. For centuries, garlic has been a potent natural remedy. But what if I informed you that this remarkable bulb, currently in your kitchen, could become dangerous with just 6 common errors? Buried within old medical writings and overlooked by contemporary pharmaceutical companies, there is startling information indicating that improper consumption of garlic can lead to severe reactions in your body. Recent studies indicate that a significant percentage of seniors are making critical errors with garlic, errors that could elevate liver stress by 47%, dangerously thin blood levels, or negate any benefits previously assumed. You might be ingesting it incorrectly, preparing it improperly, or mixing it with medications that could make it harmful. One study indicated that a single error diminished the effectiveness of a heart medication by 51%. That is not a myth. It is based on scientific evidence. Big Pharma prefers that you remain unaware, as the correct use of garlic can serve as a substitute for several medications. However, if misused, it may lead to severe consequences. This video reveals 6 surprising garlic errors that often go unnoticed, but are essential for every senior to understand. Additionally, the second error could gradually harm your brain without your awareness. Before we explore these important insights, I have 2 questions for you. Have you ever had surprising reactions after consuming garlic? Secondly, how do you prefer to prepare garlic? We are reviewing and responding to all comments with tailored tips and guidance. Let's begin with the least harmful option and progress toward the more serious mistake that could have dire consequences. Error 6. Inadequate storage conditions. One of the less frequent yet still hazardous errors is the improper storage of garlic, especially when it is kept in oil. Chopping fresh garlic and placing it in oil at room temperature creates an ideal setting for Clostridium botulinum, the bacteria responsible for botulism. This anaerobic bacterium flourishes in environments devoid of oxygen, such as oil-covered garlic. A study featured in the Journal of Food Protection analyzed 48 instances of foodborne botulism associated with homemade garlic in oil preparations. The researchers discovered that storing at room temperature for only 48 hours resulted in a 400% increase in toxin production. The alarming aspect is that botulinum toxin lacks both odor and taste, which means its presence remains undetected until symptoms manifest. The initial signs are mild, including blurred vision and a dry mouth, but within a span of 12 to 36 hours, paralysis starts to extend from your face down through your body. The toxin inhibits nerve signals to muscles, and without prompt medical attention, respiratory failure may ensue. In the recorded instances, 23% needed mechanical ventilation. The answer is quite straightforward. To prepare garlic-infused oil, ensure it is stored in the refrigerator and consumed within a week. Lower temperatures significantly inhibit the growth of bacteria. It's preferable to prepare small batches fresh as required. Commercial preparations are reliable as they include acids or preservatives that inhibit bacterial growth. Adding citric acid or lemon juice to your homemade version will lower the pH below 4.6, creating an environment that is inhospitable for botulinum. For optimal safety and advantages, consider using this approach instead. Roast whole garlic cloves in olive oil at 300 degrees Fahrenheit for 45 minutes, then strain and refrigerate right away. The heat eliminates any existing bacteria, and the flavor of roasted garlic is indeed more intricate and advantageous compared to raw forms. Error 5. Integrating garlic with diabetes treatments. Advancing on our danger scale, we come across an error that impacts millions of individuals with diabetes globally. Garlic has compounds that can reduce blood sugar levels, which seems advantageous until you consider the effects when it interacts with diabetes medications. A study conducted by the National Institute of Diabetes in India examined 146 individuals with type 2 diabetes who consistently took garlic supplements in addition to their prescribed medications. The study found that 31% experienced hypoglycemic episodes, with blood sugar levels falling below 50 milligrams per deciliter, a level that is critically low. 9 participants needed to be hospitalized urgently. The active compound allicin found in garlic boosts insulin sensitivity and improves glucose uptake by cells. When you are already using metformin or insulin, incorporating large quantities of garlic can lead to an intensified effect. Your blood sugar can drop quickly, leading to confusion, seizures, or loss of consciousness. Dr. Sarah Chen, an endocrinologist at Johns Hopkins, reported a case in which a patient taking 4 cloves of raw garlic each day while on metformin suffered from severe hypoglycemia. His blood sugar fell to 38 milligrams per deciliter while he was asleep, and his wife discovered him unresponsive. Only the prompt administration of glucose preserved his life. The adjustment involves not eliminating garlic completely, but rather focusing on timing and careful monitoring. If you have diabetes and wish to enjoy the benefits of garlic, it's advisable to include it in your meals instead of taking it on an empty stomach. This delays absorption and helps avoid sudden drops in blood sugar levels. Begin with minimal quantities such as 1 clove each day and keep a close watch on your glucose levels for a duration of 2 weeks. It is essential to notify your doctor regarding your garlic intake. Your medication dosage might require adjustment. Numerous patients effectively include garlic in their regimen by slightly decreasing their medication with medical oversight. It is essential to introduce changes slowly and to keep a close watch on the process. Opt for cooked garlic instead of raw, since cooking decreases allicin levels by approximately 40% while preserving other advantageous compounds. Fourth mistake, consuming raw garlic on an empty stomach. This error has resulted in numerous individuals visiting emergency rooms due to severe discomfort. Consuming raw garlic on an empty stomach may lead to serious issues if you suffer from ulcers, gastritis, or inflammatory bowel conditions. The sulfur compounds in garlic that contribute to its medicinal properties can also be quite irritating to damaged digestive tissues. A study in gastroenterology conducted by Sewell National University monitored 89 patients diagnosed with stomach ulcers who ingested raw garlic. In the group, 42% had severe bleeding episodes, and 18% needed blood transfusions. The mechanism is harsh in its straightforwardness. Allicin and various sulfur compounds enhance the production of stomach acid while also causing irritation to the protective mucus layer. Dr. Michael Torres, a gastroenterologist based in Miami, discusses the case of a patient who consumed 3 raw garlic cloves each morning for immune support. Unbeknownst to her, she was developing ulcers. One morning, she felt intense pain accompanied by the vomiting of blood. The garlic had burned through her ulcer, leading to a perforation that necessitated emergency surgery. The inflammatory response extends beyond the stomach. Individuals with Crohn's disease or ulcerative colitis encounter comparable risks across their digestive system. Raw garlic can initiate inflammatory responses that may lead to significant flare-ups lasting for weeks. A documented case featured a 34-year-old man whose Crohn's disease had remained in remission for 2 years until he began a raw garlic regimen. He was admitted to the hospital for intestinal bleeding within 5 days. The solution necessitates thoughtful adjustments rather than complete removal. For those with any digestive issues, it is advisable to avoid consuming raw garlic on an empty stomach. It is advisable to consume it alongside food, ideally something alkaline such as milk or yogurt, which helps to neutralize acid. Alternatively, you can lightly cook your garlic, which decreases irritating compounds by 60% while maintaining most of its benefits. Explore aged garlic extract as a potential option. The aging process transforms harsh sulfur compounds into milder S-acetylcysteine. Research indicates that aged garlic offers cardiovascular advantages while minimizing digestive discomfort. If you need to use fresh garlic, consider this approach. Chop 1 clove finely and combine it with a tablespoon of honey, then stir it into warm water until dissolved. The honey envelopes your stomach as dilution lessens the concentration. Error 3. Eating garlic prior to surgery. This is where the situation becomes truly dangerous. Garlic acts as a potent natural blood thinner, and its consumption prior to surgery may lead to excessive bleeding. Many individuals are unaware that something as seemingly harmless as garlic bread can transform a standard procedure into a serious medical situation. The New England Journal of Medicine released a detailed examination of 4,832 surgical cases involving patients who face significant bleeding issues. Of the cases, 8.7% were directly associated with garlic intake in the week leading up to surgery. The research indicated that individuals who ingested over 2 cloves each day experienced an increase in bleeding times by as much as 250%. Dr. Jennifer Park, an anesthesiologist at Cleveland Clinic, remembers a troubling experience. A patient undergoing routine gallbladder surgery started to experience excessive bleeding. Even with typical pre-operative blood tests, the surgeons were unable to attain hemostasis. It was only during the post-operative investigation that the medical team found out the patient had been consuming concentrated garlic supplements, which was equivalent to ingesting 15 cloves each day. The mechanism consists of several pathways. Garlic prevents the clumping of platelets by utilizing adjuvants and various other compounds. It also disrupts thromboxane synthesis, which is essential for blood clotting. The effects may persist for as long as 7 days following consumption, indicating that the garlic you consumed last week could still influence your surgery today. The true risk is found in how it interacts with other elements. When using aspirin, fish oil, or vitamin E with garlic, the anticoagulant effects significantly increase. There was a recorded instance of a patient who consumed all 4 substances and almost experienced fatal bleeding during dental surgery. The oral surgeon was unable to control the bleeding following a straightforward tooth extraction. The protocol is definitive and must be adhered to without exception. Cease all intake of garlic, including supplements and foods that contain garlic, for a minimum of 10 days prior to any planned surgery. This encompasses dental procedures, biopsies, and colonoscopies as well. Notify all healthcare providers about your garlic consumption, regardless of how insignificant the procedure may appear. In the event of emergency surgery, it is crucial to inform the surgical team about any recent garlic intake without delay. They are able to prepare blood products and clotting factors ahead of time. Certain hospitals have begun to specifically inquire about garlic consumption during pre-operative evaluations due to the considerable risk involved. Another error is consuming large amounts of raw garlic. This is the surprising error that leads many to emergency rooms, yet is mostly overlooked. The current trend of consuming whole bulbs of raw garlic for detoxification or immune enhancement can lead to serious chemical burns, hemolytic anemia, and potential organ damage. Over a span of 2 years, Stanford University Medical Center recorded 67 instances of garlic toxicity. Patients generally ingested between 15 to 30 raw cloves each day, operating under the assumption that a higher quantity would yield superior outcomes. The outcomes were severe. 23 patients experienced chemical burns in their esophagus, necessitating endoscopic intervention. 11 developed severe hemolytic anemia that necessitated transfusions. The chemistry is remarkably straightforward. In large quantities, allicin acts as a potent oxidizing agent. It causes significant harm to red blood cells via oxidative damage. Dr. Robert Kim, a hematologist participating in the study, notes that hemolysis caused by garlic can happen within 72 hours of excessive intake. Patients present with dark urine, extreme fatigue, and critically low hemoglobin levels. A notably serious case featured a 28-year-old fitness influencer who advocated for the consumption of 25 raw cloves each day. After a week, she collapsed while exercising. Her hemoglobin decreased from the normal level of 14 grams per deciliter to a dangerously low 5 grams per deciliter. She needed 4 units of blood and was in intensive care for 5 days. The burns to the esophagus are also quite serious. Concentrated allicin can lead to injuries that resemble those caused by acid burns. Endoscopy images reveal ulceration, bleeding, and in severe instances, perforation. These injuries may lead to lasting scars and challenges with swallowing. One patient experienced significant strictures that necessitated surgical intervention, limiting her to a liquid diet for 6 months. The recommended maximum intake, based on various studies, is 4 cloves of raw garlic per day for adults, provided it is consumed in moderation throughout the day with meals. The recommended amount that offers advantages without any associated risks is typically just 1 to 2 cloves each day. Anything beyond this provides no extra advantages while significantly heightening risks. Error 1. Consuming garlic alongside blood-thinning medications. One of the most critical errors is mixing garlic with anticoagulant medications, such as warfarin, clopidogrel, or newer options, like apixaban. This combination has resulted in severe bleeding incidents, and the medical literature includes many recorded fatalities. A meta-analysis of 312 significant bleeding events in patients using both garlic and anticoagulants was published in the American Journal of Hematology. The research indicated that there were 71 instances of intracranial hemorrhage, accompanied by a mortality rate of 34%. These are not merely numbers. They represent avoidable tragedies. Dr. Lisa Thompson, a cardiologist at Mass General, provided treatment to a 62-year-old man who was on warfarin for atrial fibrillation. He began using garlic supplements without consulting his doctor. His INR, which assesses blood clotting time, increased from a therapeutic level of 2.5 to a concerning 8.3. He experienced a sudden brain hemorrhage during the night and passed away before arriving at the hospital. The interaction is collaborative and uncertain. Garlic not only contributes to the blood-thinning effect, but also enhances the medication through various mechanisms. It disrupts cytochrome P450 enzymes responsible for metabolizing these drugs, leading to a significant increase in medication levels. At the same time, garlic's antiplatelet properties exert a dual impact on your clotting system. Even amounts that appear to be harmless can pose risks. A case report from Toronto detailed a woman who experienced retinal hemorrhage following the consumption of garlic bread at a restaurant. The quantity of garlic was under 2 cloves, yet when mixed with her medication, it resulted in irreversible vision loss in one eye. What's truly alarming is that bleeding can happen in any location. Reported instances encompass gastrointestinal bleeding, hemorrhagic stroke, bleeding into joints, and even spontaneous muscle hemorrhages. One patient experienced significant bleeding in his thigh muscle simply from colliding with furniture. He needed urgent surgery and was close to dying from blood loss. If you are taking any blood-thinning medication, it is important to avoid garlic in medicinal amounts. This encompasses supplements, raw garlic, and concentrated formulations. Using small amounts in cooking is usually safe, but maintaining consistency is important. Avoid consuming garlic-heavy meals inconsistently, as abrupt changes can influence drug metabolism. Full openness with your healthcare team is the only reliable method. If you wish to enjoy the benefits of garlic while taking anticoagulants, it is essential to collaborate with your doctor to closely monitor your clotting parameters. Certain patients effectively manage small quantities through careful adjustments of medication doses and regular INR monitoring. Nonetheless, this necessitates medical oversight and is generally not advisable for the majority of individuals. Optimal methods for utilizing garlic to achieve the greatest advantages. After discovering these hazardous errors, you may question whether garlic is a worthwhile choice. The answer is definitely yes when applied appropriately. Research has uncovered a highly effective approach that enhances advantages while removing risks. Effective approaches begin with thorough planning. Crushing or chopping garlic activates an enzyme known as alliinase, which transforms allicin into allicin, the main medicinal component. This is the essential aspect that many overlook. Crushed garlic should be allowed to sit for precisely 10 minutes before it is cooked or eaten. Research from Penn State indicated that this waiting period enhances allicin formation by 1/900% in comparison to immediate use. Temperature is of great significance. Raw garlic offers the highest level of allicin, but it can be quite intense. The ideal temperature is a gentle heat of 140 degrees Fahrenheit for a maximum of 15 minutes. This temperature maintains 82% of allicin and reduces digestive irritation. A study involving 3,794 participants demonstrated that this method offered the same cardiovascular benefits as raw garlic, with no side effects reported. Timing plays a crucial role. Incorporate garlic into your most substantial meal of the day, preferably one that includes healthy fats. Garlic's fat-soluble compounds are more effectively absorbed when consumed with dietary fat, enhancing their bioavailability by 45%. Avoid taking garlic supplements on an empty stomach or right before bedtime, as this may heighten the risk of reflux. The recommended daily amount, supported by various research, is 4 grams of fresh garlic, equivalent to 1 large clove. This amount delivers 5 to 6 milligrams of allicin, sufficient to effectively lower blood pressure and cholesterol while remaining within safe limits. A meta-analysis of 29 studies found that this dose lowered systolic blood pressure by an average of 8.4 millimeters of mercury. This is a method of preparation that optimizes advantages. Crush a clove and allow it to rest for 10 minutes. Combine it with 1 tablespoon of extra virgin olive oil and a pinch of sea salt. Apply this mixture onto whole grain bread and heat it lightly in a toaster oven. The combination offers complementary advantages, as olive oil compounds improve garlic absorption while safeguarding your stomach lining. Aged garlic extract serves as a great alternative for individuals who find fresh garlic intolerable. The aging process, lasting up to 20 months, transforms harsh compounds into S-allyl-cysteine and other milder derivatives. Research indicates that 600 milligrams of aged extract offers similar advantages to fresh garlic without any adverse effects. Think about varying your garlic consumption. Incorporate fresh garlic for a duration of 2 weeks, followed by a transition to aged extract for 1 week. This approach helps maintain balance while allowing your digestive system regular intervals of rest. Numerous practitioners indicate improved long-term adherence with this method. Black garlic is often overlooked. It undergoes fermentation at regulated temperatures for a duration of 3 weeks. This method enhances antioxidant levels significantly and results in a sweet, molasses-like taste. Korean research indicates that black garlic enhances cholesterol profiles 40% more effectively than fresh garlic. Keep your garlic in a cool, dry area that allows for proper airflow. Do not refrigerate whole bulbs, since moisture can lead to harmful mold development. After peeling or chopping, utilize within 24 hours or freeze in portions with olive oil for future use. Ultimately, keep in mind that garlic is a potent remedy, but similar to any treatment, its effects can be beneficial or detrimental based on your approach to its use. These 6 mistakes pose significant risks that have impacted countless individuals. When utilized properly, garlic stands out as one of nature's most advantageous foods. Begin gradually, acknowledge its strength, and consistently take your personal health situation into account. Your life could truly hinge on it. We are eager to receive your feedback. Have you ever committed one of these errors? Do you have a garlic routine that suits your needs? We invite you to share your experiences and thoughts in the comments section below. We appreciate hearing them. Thank you for watching.